Uh, Assalamu alaikum. My name is Dr. Ashik Hussain and I am Assistant Professor of Anatomy at Rashid Latif Medical College, Lahore, Pakistan. In my previous video, we talked about typical spinal, thoracic vertebra. But in this video, I will just try to concentrate on more on the atypical thoracic vertebra. So this is the spine, vertebral column. As we can see it here, we can see different these vertebrae are cervical vertebra, whereas these vertebrae below, now highlighting, these are the thoracic vertebrae, and they are 12 in number. And just beyond these thoracic vertebrae, we have got lumbar vertebrae and so on. So just to focus on the thoracic vertebra, I would rather, better, concentrate to remove these, cervical vertebra, so we can very well concentrate on thoracic vertebra. So here I'm removing these vertebrae. This one was the C7. Now this is the first thoracic vertebra. Here we can see this first thoracic vertebra is atypical vertebra. It is atypical vertebra. First thoracic, and then this T10, T11, and T12. These are atypical vertebrae. Why this vertebra is called atypical vertebra? I will just show you. Look at this vertebra, the shape of this vertebra. First, look at the atypical vertebra. Typical vertebra, we discussed that these costal, facets are the features of thoracic vertebra, where head of the rib it articulates or it forms a joint, and these are in the form of demifacet. Whereas you just look at the first thoracic vertebra, here you are not finding this facet as a demifacet, rather it is a complete facet, completely round structure. And another demifacet which is on the inferior, near the inferior end plate or inferior part of the thoracic vertebral body. So this first vertebra actually has 1.5 facets. One complete facet for the first thoracic vertebra, and other is the half thoracic, or demifacet for the second rib. So whereas when you look at rest of the vertebral bodies, they all having this is demifacet, this is demifacet, this is demifacet. Here you see demifacet, 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 demifacet. So it means that actually one rib is articulating with the two vertebral bodies. The upper part of the rib articulates with the demifacet of the above vertebra, whereas the same number of the vertebra, superior demifacet articulates with the lower part of the same number of the rib. So when you go down further, here you see that this is the ninth thoracic vertebra, where you are not seeing any inferior demifacet. Rather, there is only one demifacet on the near the upper part of the vertebral body. So when it comes to 10th thoracic vertebra, here there again the demifacets are gone. Rather, there is one complete facet, half on the pedicle and half on the body. If you go further, here you see on the 12th thoracic vertebra, this facet, there is again no demifacets, rather complete facet, and this complete facet has shifted backwards and inferiorly, and to lie completely on the pedicle. So this 10th, 11th and 12th, these three vertebrae are atypical, and this first vertebra is atypical because it has got 1.5 facets, and rest of the vertebra in between, they have all of them, they have got demifacet except for the this vertebra where demifacets, only one demifacet is present, and near the upper part of the body lower demifacet is gone, because from here onward, from here onward, there is no need of demifacet, because 11th and 12th ribs, they completely and independently articulate with the facets, and facets are complete now, not in form of demifacet. And in case of 11th vertebra, this you can see this demifacet is half on the body and half on the pedicle, whereas in the vertebra below, it has this facet is now moving backwards and downwards and to lie completely on the pedicle. So these were the features of the atypical thoracic vertebra. So again, first vertebra is atypical because it has got 1.5 facets, and then 10th vertebra is atypical because demifacet is only one, and this demifacet, look at the shape, it is also going to be complete facet, and in next vertebra it has been completed and lie half on the body and half on the pedicle. In the 12th thoracic vertebra, it completely shifted backwards and inferiorly onto the pedicle of the thoracic vertebra. So this was these were the features of the thoracic vertebra. And look at the body shape of the T1 vertebra. It is more like cervical than like typical thoracic vertebra. And again, now look at the shape of this vertebra. Now this shape is changing to heart shaped bodies, and look at the shape now. This is heart shape, this is heart shape. So likewise, so these were the features of the atypical thoracic vertebrae, and I hope that you have got insight of the topic what I'm just trying to explain. Thank you very much.